Hello and welcome to this knee osteoarthritis talk. My name is John and I'm a specialist physiotherapist working at the Royal Glamorgan Hospital. You have been invited to watch this because you have been diagnosed with knee osteoarthritis. The diagnosis may have come from your GP, physio or consultant, and the purpose of this talk is to help you understand what OA is and what it isn't. We will go through the treatment options and hopefully help you come up with a plan on how to help your knee pain. I'm only going to talk for about 20 minutes, so get yourself a cup of tea, sit back, relax, and hopefully I can help you understand a little more about your knee pain and how to manage it. So what is OA? You may have been told, or you may believe, that it is bone on bone, or that the bones are rubbing, or the cartilage is worn, or that it's wear and tear. Unfortunately, these are common ways of describing arthritis that aren't quite true, or certainly aren't the full story. Arthritis is aging of the joint, but there is a big difference between aging and wear and tear. You don't get older without some grey hair and some wrinkles, and the same can be said for your joints. These changes are normal. Almost 50% of people over the age of 40 will have some sign of arthritis on an X-ray, but very few of these people will have pain. And only 10% of the people over the age of 60 will go on to develop painful OA. Signs of OA on X-ray don't tell us whether someone has pain, and they don't seem to always change that much over time. Decades can go by, and even though pain can get better or worse, there doesn't seem to be a huge amount of change on an X-ray. This is why X-rays are not necessary for the diagnosis of OA, but also don't tell us how someone's knee feels or how much pain they are in. As a physio, I have seen severe OA on an X-ray when the person describes no pain, and I've seen completely normal X-rays when the person describes high levels of pain. So what I mean by this is that signs of OA on an X-ray can be quite normal, and we shouldn't pay too much attention to some of the ways in which people describe OA. It makes no sense that when someone says to you that you have wear and tear, and then tell you to go do some exercise with the physio. A better way to think about it is, if you don't use it, you lose it. Joints like movement, and this is why exercise can help. Having a diagnosis of OA does not define your knee, and your X-ray is not the thing that tells you how you feel, and it certainly isn't the thing that tells you if you can get better or not. So what causes OA? Well, again, we're led to believe that wear and tear over a period of time through sporting activities, general activity or work is the thing that causes OA. But when we look at the evidence, it is more to do with age, like we've just talked about, being overweight, which isn't just about more weight on your joints, but the fact that fatty tissue releases more inflammatory chemicals into our bodies, and this has an effect on our joints. Previous knee joint injury, like a knee ligament tear or meniscal tear, is something that may increase your chances of having OA. And thigh muscle weakness. Joints like muscles. Muscles look after joints. And so if your thigh muscles are weak, then this may be a reason why you have developed OA. What doesn't cause OA? Exercise doesn't cause OA. Living an active lifestyle doesn't cause OA. Participating in sport doesn't cause OA. If you went through your sporting days without any significant knee injuries, then this isn't the reason for your OA. If you used to be a runner or still are a runner, then this isn't the reason for your knee OA. And I would actually encourage you to keep running because runners have less OA on X-rays and less knee pain. Occupation gets a lot of blame, but again, there is not a huge amount of evidence to suggest that this is related to OA. The evidence that is out there suggests that if your work involved a lot of squatting with weight and kneeling, then it may be related. But in my opinion, there are more important factors that we need to focus on. So again, we shouldn't blame our work for our joint pain. The things that do cause OA are age, previous knee injury, and then the things that we can change, like weight and thigh muscle strength. Weakness and a lack of activity are big risk factors for developing OA. So there are things that we can change here, and these things can improve your pain. It is not too late to change your pain. We've already started myth busting on the previous slides, and it is important to understand what is true about OA. OA is not due to wear and tear. We need to forget about labels like bone on bone. They're not helpful. Pain does not mean damage, and OA knees are no more weak or vulnerable than healthy knees. X-ray findings do not link well with pain. OA does not always get worse over time, and it is never too late to change. OA is not made worse by exercise. Exercise can help people with OA no matter how severe. If you have mild to moderate OA, then there is a good chance that this can get better with exercise. And even if it is severe OA, then it may still help. So why do we promote exercise for OA? Well, firstly, exercise is safe for our joints, even if it hurts. Exercise does not wear out your cartilage. In fact, it may help strengthen your cartilage. Exercise can reduce your pain and improve your function. Exercise can help you lose weight and get your muscles stronger. And let's not forget that being overweight and having weaker muscles are two of the main reasons why we develop OA in the first place. Plus, the only side effect of exercise is improving your general health, so there is really no reason not to do it. There are no bad forms of exercise. You can walk, run, swim, lift weights, go dancing, as long as you start off gently and then do more over time. So pick a form of exercise that you enjoy. That way it is less of a chore and more fun. Also, if your thigh muscles are weak, then you may benefit from a specific strengthening program. And sometimes this needs to be done prior to returning to an exercise or activity that you might want to do. But we can help with that. Importantly, exercise takes time. It may take 3 to 6 months to make a significant change. You have to be patient. So what do the experts say about exercise and OA? Stronger thigh muscles reduce pain and slow OA progression. Walking less than 6,000 steps a day may actually lead to OA. People over the age of 50 who run regularly have less knee pain and less OA changes on X-rays. If your knee hurts, keep exercising. 2 sessions per week for 6 weeks can reduce your knee pain by 25%. Stronger thigh muscles and better walking ability before surgery leads to a better outcome after joint replacement. So even if you have decided that surgery is right for you, then exercising beforehand can make your recovery easier. Body weight and OA. A lot of you may have been told to lose weight to help your knee pain, but it is hard to lose weight, particularly if you are in pain. And many of you may have been trying to lose weight for many years. Now, the reason why you've been told to lose weight comes from the fact that being overweight is associated with developing OA in the first place. But do you have to lose weight to improve your knee pain? Well, the answer is not necessarily. We used to think that the main reason why body weight affected our joints was because it adds stress to our joints. And that is true, but it's not the only reason. The other reason is that being overweight has an effect on the chemicals in our body. It increases the amount of inflammation in our bodies, and this has an effect on our joints as well as other tissues. So it does make sense to try and lose weight, and your general health can improve a lot by losing weight, so we should all try to maintain a healthy weight. But if this is something that you struggle to do, then it may not be essential to improve your knee pain. Some studies have shown that in people who are overweight, exercise without weight loss can be more effective than weight loss through dieting alone. But combining exercise and weight loss through dieting has the biggest effect on knee pain. So if you are overweight and you want to change this, then a target would be to lose 10% of your body weight. Because in the studies that have looked at weight loss, this may reduce your pain by up to 50%. A way in which we can help with this is through our joint care programs, which can give advice about diet and provide supervised exercise programs. Pain is the main reason why people seek help with OA. If it didn't hurt, it wouldn't be a problem. In a long-term problem like OA, we get pain for lots of reasons. It could be stress, it could be poor sleep, it could be worry about the future, It could be that you did something that you haven't done for a while, like walking too far or running for a bus. Not that these things are bad for you, you just might not be used to doing them. But when you have pain, it is very unlikely that it is due to damage. Think of it more that your knee is grumpy or sensitive. But actually, when you are doing exercise, it is okay to push into a little bit of pain. Using a pain scale like the one on the screen while exercising can be a good way to monitor this. Exercising with less than a 5 out of 10 pain level is quite safe. If the pain is tolerable and doesn't get worse the next day, then this is okay. Muscle soreness is to be expected, but what we don't want to see is more swelling or joint pain affecting your function. And then over time, what you should notice is that you can do a little bit more activity or exercise with the same or less pain. Completely avoiding pain means that you get into a cycle of doing less and less, and you don't get better at doing things that you avoid. When you start an exercise program, it is very likely that your pain will get worse for a couple of weeks, but this should improve. This again is not due to damage, but just because you may not be used to doing an exercise or an activity. Some helpful tips for managing pain are to start an exercise or activity gently and make it more challenging over time. Get into good sleep habits. Sleep is great for recovery, and simple habits like reducing caffeine and screen time in the evenings, being consistent with bedtimes, having some relaxation time before you go to bed can all help improve sleep and pain. Pace yourself. You need to be patient with your body as it takes time to change. Use your painkillers. There are no painkillers that completely get rid of pain, and for some people, painkillers don't work at all. But if you think your painkillers are helping, even a little bit, then use them so that you can do more activity. Pick a form of exercise that you enjoy. When you do something that you enjoy, then it is likely to not hurt as much. Other ways to improve pain can be to use splints or braces. Particularly if your OA is on one side of your knee, then an offloader brace can be used. Walking sticks and crutches can help reduce pain by reducing the stress being placed on the knee. A TENS machine is something that can improve pain, and some people find these very useful. Injections are a little controversial. Injections use steroid to reduce inflammation within the joint. Some people find huge amounts of benefit, but others do not. And repeated injections over time may cause more harm to the cartilage. However, if you are just trying to control pain while you are waiting for a knee replacement, then this may be an option. Or if you are trying to reduce pain so that you can take part in an exercise program, then again, this can be something to try. The last thing to talk about is surgery. The main surgery for OA knee is a knee replacement. Some people may have had arthroscopies or washouts in the past, but these types of surgery do not help for OA. A knee replacement has an 80% success rate, which is pretty good, but that does mean that 1 in 5 people are not happy with the outcome. Wanting a knee replacement is fine, but just be sure that you have considered all the options, because once you have it, you can't go back. Unfortunately, the research shows that people are not more active after a knee replacement. So if you want a knee replacement to reduce pain, then this is fine. But don't think it will get you back doing all the activities that you haven't been able to do. This is more to do with creating good habits, and this is something we should work on before you have your surgery. And again, improving strength and walking ability before surgery can really help your recovery after surgery. Finally, we want you to make an informed decision about how we manage your knee pain. There are guidelines for the treatment of knee OA. These say that everyone with knee OA should try the treatments in the green part of the triangle on the screen. This includes self-management through following advice about exercise and weight loss, using simple pain medication, trying a knee brace or TENS machine, or a combination of all of these. Now, our current situation with COVID-19 is that some of the programs that we would include in this group of treatments, like the National Exercise Referral Scheme and our joint care programs, are not running at the moment. So if you are happy to try some of these self-management strategies using the advice you have been given, then go ahead. But if you feel that you will want a little more support and guidance, or if you have tried some of these things and haven't improved, then please refer yourself to the physiotherapy department. This can be done via our webpage. Those who don't improve through self-management should seek a more formal physiotherapy program. We can also offer joint injections to help manage pain as you go through your treatment. But if you still don't improve at this point, then you may want to think about a joint replacement. Very few patients actually get this far without improving with the other treatments. And what I would like to happen now is for you to consider your options. If you would like to speak to a physio about how you can manage your knee pain, then you can self-refer on the Cwmtaf Morgannwg website or use the link below. They can answer any questions that you may have and discuss treatment options. As a team, you and your physio will develop the best treatment plan for you. Your physiotherapist will guide you through this or refer you on to a more appropriate service. Thank you for listening, thank you for your time, and I might speak to you soon.